clinic and to deliver at the clinic. Because we were told that many women, pregnant women, they don't go to the clinic because the mother-in-law denied them. Because she delivered back home in some kind of dark hut somewhere. So she can't understand why her daughter should deliver to this clinic and she would like to have control. When we pay, then they have some incentive, they get some power. And the government of India and Norway has cooperated in some programs so we actually pay women for coming to the clinic. And then they get some power to do so.
And Prime Minister, what happens if that woman, there's no infrastructure for her to get to the hospital? Because as you know, that's a huge problem. If you look at the world's newest nation, South Sudan, massive country, the size of what Kenya, Burundi, Rwanda and Uganda combined, and it's got 60 kilometres of paved road. And you know it's got one of the world's highest maternal mortality rates, where women die principally from hemorrhaging because they're not being attended to properly and there's no sufficient blood transfusion service there for them. There's not the adequate refrigeration, even if you had the blood donors. So the question is this really, a roundabout way of asking you, when you are trying to deliver better health outcomes, can you afford to neglect infrastructure? Because very little money, development aid, as you know, goes into infrastructure, and that's something that a lot of applicants in particular say, give us the money for the infrastructure.
But this underlines that things are very interlinked. One of the things we learned or focused very much on when we started with Gavi and immunization vaccines was not only to buy vaccines, but it was to develop the infrastructure, the basic healthcare. But as soon as you have developed the basic healthcare to develop or to deliver vaccines, immunization, you have also developed some of the healthcare or infrastructure you need to, for instance, assist women who are delivering a child or giving birth. Or at least to give them some of the basic medicines which is needed to stop bleeding. So if we succeed in one area, for instance, building up the vaccine infrastructure, we will also be better equipped or better able to also do something with the infrastructure related to maternity.
Bill Gates, to build any roads?
Well, the World Bank, which Norway's one of the supporters of, does a lot of infrastructure loans. And you really want to do two things in parallel. You want the infrastructure to come up, which helps the economy, and you want to improve health. Because after all, if you have a high percentage of your kids suffer malnutrition, cerebral malaria, they're just not able to contribute. And so health is a huge thing that holds these countries back. Both the number of kids who live but are damaged in a way they can't achieve their potential. And when you have very bad health, parents decide they are going to have a lot of children, have a very high degree of probability that several will live into adulthood to support them. And so there's a complete link between bad health and high population growth. And that high population growth makes it hard to feed, hard to educate, hard to provide stability. So if you want to take one thing that's primary, I think you take health. But it doesn't mean that you don't, in parallel, work on education, infrastructure, and all those other issues.
And that leads us to another question that we got on Twitter, which is this: how do you set targets that incorporate the social determinants of health at the national and global level? And if I just spell that out for you, as you both know very well, work done, pioneering work in particular by Professor Michael Marmot for the World Health Organization, the WHO, a few years ago, and again, their commitment to trying to work on the social determinants of health was renewed again in Rio de Janeiro in July 2011. And the idea is this, and I've seen this myself, as I'm sure you have, that there's no point just working on the health sector in isolation of other determinants that decide whether a person is going to continue to be healthy or not. I've seen a kid in Uganda clutching its antiretroviral drugs, HIV positive. I've got my antiretroviral bag here, and he's going back to some terrible shack. He's got no clean water. He's got inadequate nutrition. Has that child's health really been fixed because he's been given the drugs for his HIV positive state? And so the social determinants of health, a lot of people say, you cannot just talk about the health community in trying to deliver better health outcomes. You've got to look at roads, as we were saying, you've got to look at shelter, you've got to look at education, all these things. And so when you're trying to improve these things, you've got to have an intersectoral approach, not just at the community level, but also at the national and global level. So when you have an event like this, Prime Minister, you don't just invite the Ministers of Health from Nigeria or Malawi, you also invite the Ministers of Finance, the Minister of Education. And so that kind of leads on from the discussion we've just had now about infrastructure. So that is the question, how can you incorporate the social determinants of health in the work you do, both through your government and also you, Mr. Gates, through your foundation?
But in one way, that's exactly what we try to do with the Millennium Development Goals. Because if you just approach development issue as one big interlinked issue, it's hard to establish some measurable goals. So what we did before 2000 was to have a long process within the UN. And then actually it was a big achievement in itself that we were able to agree on 8 measurable development goals. They are, of course, interlinked. Number one, to reduce the number of people living in absolute poverty by 50%. Is in one way basic, but and that's a goal we have already reached. We are, as I said, ahead of schedule. Reducing poverty is, of course, important for reaching the other goals: improving health, reducing maternal deaths, education, and so on. But I think that even if everything is interlinked, it is important that we try to distinguish different strategies, different measures. And even if I understand that if you immunize a child, it's not safe from every problems in the world, it is important that that child is immunized. So we have program for immunization, we have all the programs for education, and we have some other programs for maternal health. So I can't, in one way, I can't understand why we shall say that we have to choose. We have to move on the broad agenda, and the development goals are this broad agenda, and they're measurable.
Bill Gates, on this particular question of looking at the social determinants of health and not just looking at the health sector or the health community and working across sectors, so you're not all working in silos?
Well, certainly the health is where we've seen a dramatic impact. People are working in parallel on things like agricultural productivity, which is fantastic because it raises the incomes of the poorest in the world, the vast majority of which are farmers with very small plots of land. And as they get better seeds, that improves nutrition, lets them raise money, send the kids off to school, and so you get kind of a multiplier effect of the health work and the agricultural work coming together. And then you're able to bring in private sector activities. A lot of the road building can be done out of domestic resources if the children aren't growing up with the debilitated by the malnutrition and the cerebral malaria. And so, if we could only work in one sector, I'd say we'd work in health. But in fact, we're not. We're working in all these things and how they combine. And advanced new tools like a new vaccine, you see that same type of wonderful thing in the agricultural space where you see these new seeds, many of which are almost twice the productivity. We saw that in Asia with Green Revolution for some of the primary crops there. Africa, in a way, didn't get that benefit because it wasn't adapted to their particular needs and crops. And so we're just now going through an African Green Revolution. So agricultural productivity combined with these health interventions. And that's why GDP growth in Africa is very, very strong, strongest of any continent, although starting off at very low levels.
Sure, and I should just say in that regard with agriculture, of course, Kofi Annan, who has berated African governments recently again for not spending enough of their budgets on agriculture. But Mr. Gates, I mean, as you say, your mission statement for the foundation is not only just to improve the health of people worldwide, but it's also, as you say, to help them lift themselves out of extreme hunger and poverty. And as you say, you're now doing work in agriculture, because we know a large number of farmers, particularly in Africa, are women. You're also putting some of your money into clean water, sanitation. So when did you, it was a bit of a journey though, because this is something that your foundation has done more latterly, isn't it? When did you decide that to try to improve global health, you had to look at these other fields, other factors?
Well, actually, we started simply focusing on reproductive health, making sure tools of contraception were available to all the women who wanted those tools. Because we saw the population issue is very primary, whether it's the environment, the stability. And it was only as we worked in that community that we found out that as you improve health, the opposite of what you might think happens, which is that the actual population growth goes down. And so that gave us the permission. In fact, it almost demanded that we start investing in malaria, investing in new vaccines. And so reproductive health and health broadly. Then with the generosity of Warren Buffett putting his resources into the foundation, we saw that we could branch out and look at some of the surrounding issues: sanitation, agriculture, financial services, the things that can really get people to the level where they're sustaining themselves and eventually don't even need that aid on an ongoing basis.
You put in what, $17 billion, was it, Warren Buffett?
Yes,
so something like that into your foundation. Not disputing that figure. And Mr. Gates, you obviously are somebody who made their wealth in the private sector, and I think you talked, and you have also, Prime Minister, in the past talked about the need to involve the public sector with the private sector, because we know that the private sector often is more governed by what is efficient and so on. There are lessons for the public sector to learn from that. And one of the things which is not often talked about is that the global aid industry is inefficient. You do see a great deal of duplication. If you look at South Sudan, it's got more aid agencies working there than any other country on earth. And the government there says, for God's sake, tell us what you're doing, where you're doing it, and how you're doing it, because there is that lack of coordination. So when it comes to looking at the global aid industry, including the health sector in which you both focus your work, do you believe that A, there should be more potential for partnerships with the private sector, and that there are lessons to be learned in terms of more efficiency and more effectiveness? Bill Gates?
Well, the private sector has certain skills that we're absolutely dependent on. The deepest expertise in inventing new vaccines is in the pharmaceutical companies. And yet, because they're driven by a profit goal, the people who have malaria don't have money, and so their voice in the marketplace is nothing. And in fact, so the best way to bridge that is to take donor generosity and provide it as an incentive to these private companies, then to apply all that scientific expertise. And so we have a lot of partnerships with the pharmaceutical companies. In fact, every year we give them a rating called the Access to Medicines Index that shows which of these companies are doing the most to donate scientists and to help out the poorest, even though that isn't where they're going to get their biggest profitability. And it's been amazing every year for the last 10 years that we've had that index. The average is constantly going up. The ones at the top want to do more, the ones that aren't at the top want to improve their rank. And so bringing them in for the appropriate thing. They're not going to put out billions on their own to do these drugs. And yet, if we work with them, they'll take what they've learned from the rich world markets and they'll apply it. And they'll even provide discounts if they have a product that applies both in rich world and developing world. They'll give us very close to marginal cost pricing on the uses for the poor. So it's really, I think, another achievement of the last 15 years is that dialogue with the private sector and drawing them in, and a huge reason why we've made the progress that we've had.
In particular, pediatric antiretrovirals, which there wasn't really so much of a profit motive for the pharmaceuticals to introduce that. But sorry, again, something you wanted to
No, I'll just underline that if we're going to reach the Millennium Development Goals, we have to mobilize more development aid and better development aid. And we can achieve both by going together or making more partnerships with the private sector. Because the beauty of the Gates Foundation and other private donors is, of course, that we get more financial resources. That is important in itself. But it has a double positive effect, because in addition to the additional funds, we also get this better understanding on how to make efficient development aid. and you are quite right, there are too many examples of inefficient development aid. There are too many examples of too many agencies doing the same. And one of the big advantages with the cooperation we established or initiated with Gavi and vaccines was that we coordinated, we made an efficient body, and we got both more money but also better money. And therefore I'm strongly in favor of private donors, partly because they give us money, but also because they provide us with a culture of cost effectiveness, which is important for the whole development community.
When it comes to the Global Alliance on Vaccines and Immunisations, Gavi, I mean, you worked on that, you gave 750 million, I think you gave 150 million, didn't you?
I remember that very well, because that was back in 2001, and that was my first meeting with the Gates Foundation. Bill didn't have time to come to Oslo, so he sent his father. And I started the meeting announcing that Norway is going to allocate 150 million US dollars. It was big applause, and everyone was very impressed by Norway and so on. And also the father of Bill Gates went up, and he was also impressed by Norway, and then he announced 750 million US dollars. That has been the case since.
Prime Minister, that's fun. You just said that you believe in more development aid and better development aid, so I think everybody agrees on better development aid, but you know that there is a big and old debate really about whether you achieve better development goals through more aid, more development aid, or whether you don't have proper development because you have weak institutions and you need to improve governance and that kind of thing. And when you look at the foundation, for instance, of Mo Ibrahim, the Sudanese-born telecoms tycoon, his foundation is very much focused on governance-related issues, and now you have the Prime Minister in the UK, David Cameron, talking about a golden thread of governance-related issues. In other words, you cannot achieve better health outcomes or any other development goals unless you have strong state institutions and so on. But you seem to still be arguing much more for more aid as being the main deliverer of better development.
I think, again, we need both. There is no contradiction between being focused on development aid, more efficient development aid, mobilizing more financial resources for instance, eradicating polio or immunizing more children or providing more life-saving commodities, and at the same time being focused on how can we build more efficient governments. And actually, I think we are more able to mobilize political support for efficient governments if we at the same time are able to show that we are willing to mobilize financial resources for helping making progress. And there are so many poor people in the world that there are more than enough people that we can provide help to, even if there are many bad governments. So again, I think we have to look for the good circles and not to say that I'm not do this before you're able to do that. We have to do both.
We've almost finished, and we go back to where we started really, in trying to meet the Millennium Development Goals and indeed to find what new frameworks there are post-2015. And a lot of people say, look, focus on the poorest. We've still got, 22 million children who still lack immunisations. We still have 19,000 children dying a day under the age of 5, 7 million a year. And, you know, when you see studies like the one that was done by OECD and ActionAid saying that a third of the world's aid reaches the poorest, the absolute poorest, that there is still a long way to go. But what do we do? Because you two gentlemen are supposed to, you know, two visionaries in this field to look ahead and tell us, post-2015, after the MDGs apparently lapsed, how do we try to deliver better health? I mean, there is an argument that's just been advanced just now by the House of Commons Select Committee on International Development. Malcolm Bruce, the chairman of that, has said perhaps we should try to advance this notion of universal health coverage for everybody as a kind of umbrella objective that just brings, you know, everything under it. Is that, and that's related to a question we got on Twitter, how to make universal health service accessible to everybody, including the poorest. Is that one way perhaps of looking to how we deliver health in the 21st century?
Well, I think the MDGs picked the right things to measure, and I think we ought to go on measuring those things. Reducing under 5 child mortality, that's absolutely the number that we should track every year and make sure that our our aid dollars are bringing that down as fast as we can. And so, you know, it can be under the umbrella